What if the cholesterol test that you've been doing for years with your doctor was leaving out one of the most crucial details about your cardiovascular health? Many people unknowingly are relying on the standard cholesterol tests, and this is missing one crucial marker that could truly predict your heart disease risk. Today we're going to focus on apolipoprotein B, or ApoB for short. And this is a powerful indicator of your heart health, and many doctors don't check it. Cardiovascular disease is the #1 cause of death worldwide. So being able to determine your risk with a simple test could be a lifesaver. ApoB is found on the surface of cholesterol-carrying particles, especially LDL, which you've probably heard of as being the bad cholesterol. But that's not quite true. And we all need some cholesterol. People can have high LDL and they may be at low risk of heart disease. Think of ApoB like the ID badge of cholesterol particles. The more ApoB in your blood, the more harmful cholesterol particles there are floating around. This increases the risk of heart disease and stroke. Research consistently shows that ApoB levels predict heart disease and heart attack, strokes, better than the standard LDL or looking at total cholesterol. And many people who have heart attacks have normal LDL cholesterol, but they have high ApoB. So without testing ApoB, you might be missing a crucial part of your heart health assessment. Think of ApoB like traffic. It's not just the amount of people in cars that's dangerous, but it's the number of cars that are on the road, increasing the risk of accidents that can be a problem. So ApoB tells you how congested your arteries are. And especially if there's high levels of inflammation markers, that increases your heart disease risk. Testing ApoB is simple, cheap, and it's just a blood test that your doctor can easily do. At Planet Naturopath, ApoB testing is included as part of our cholesterol panels, and we can add it to other blood test panels as well. It allows us to accurately assess your heart health, and ideally you want to have a level less than 80 to 90, even lower if you have a family history of heart disease or if you have high lipoprotein A or other inflammation markers on the test. A common misunderstanding is that heart disease is an old person's disease, but in reality, studies show that heart disease actually starts in your 20s, 30s, and 40s. Pathologists examining young adults who've died from accidents often find early heart disease. And while it's not enough to cause accidents, heart disease is slowly occurring so that by the time you get to your 50s and 60s, you could have a sudden heart attack, and 1/3 of heart attacks can lead to death, meaning your first sign of a heart attack could be a fatal attack. I don't mean this to be all doom and gloom. What I want you to take away from this video is that being proactive about testing your ApoB levels and making some diet, lifestyle changes could literally save your life. And the time to test is, you can test in your 20s, 30s, 40s, 50s, 60s. It's never too early to start testing. If you're younger, you can do lifestyle, diet changes to improve your ApoB levels. It doesn't mean you need to panic, start taking cholesterol medications, statins, things like that. And if you have a strong family history, this might be something you do on a yearly basis just to keep track of your levels. And you also want to look at other risk factors like C-reactive protein, homocysteine, lipoprotein A. Notice I didn't mention cholesterol, because if you're tracking ApoB, that's the main atherogenic part of cholesterol. You don't really have to worry about the other standard cholesterol tests. What can you do if you have high levels of ApoB? Well, you can start with dietary changes. Boosting fiber intake can help to lower not just overall cholesterol, but ApoB levels. This is things like psyllium husks, sunflower, lentils, legumes. They can all help to reduce the cholesterol and clear it out of the body. For some people, reducing down saturated fats can make a really big difference. This is not for everyone, but certain genetics mean that, and I have these genes, that high saturated fat diets leads to higher ApoB levels. So switching to a Mediterranean style diet with olive oil, nuts, avocado, those types of healthy fats can make a big difference for many people. Speaking of fats, boosting your omega-3 fatty acids from fish or omega-3 supplements can make a big difference. These are anti-inflammatory and being shown to reduce your risk of heart disease. Cutting out sugars and processed foods. Reducing sugars is not just about weight loss, and processed foods often have higher levels of hydrogenated fats, which can create more inflammation and drive the cardiovascular risk. So it's not just the cholesterol or ApoB that's causing heart disease, but it's the inflammation combined with the cholesterol ApoB that's the problem. Does exercise help? Well, if you talk about exercise and ApoB, it doesn't make a big difference. But exercise has such an amazing benefit for cardiovascular health that you really want to try and incorporate at least 30 minutes of exercise most days a week. This can be a combination of cardiovascular, walking, running, to strength training. So if you're in your 20s, 30s, 40s, now is the perfect time to check your ApoB, and early action can help to prevent problems later on. I would make this part of your yearly checkup when you go to the doctor and do the standard CBC, CMP testing. And then optimizing the lifestyle can help to prevent the need for surgeries later, potentially. If you're older or at high risk, you still want to check ApoB, but you might want to do some of the more advanced cardiovascular markers like the calcium score test or a CT angiogram. These tests will let you know how much plaque has built up in your arteries now. And this can be the best predictor of heart disease and also let you know how proactive you need to be right now to reduce your risk of heart attack. Depending on your levels of heart disease, potentially this is when statin medications or other cholesterol pharmaceuticals could be necessary. So to find out more about what a comprehensive cardiovascular test looks like, including looking at all the other inflammation markers that can influence cardiovascular health, watch this video here. And leave a comment below. Let me know if your doctor checks your ApoB or not.